Good morning. Thank you for joining us today. We have reached today a concerning milestone in our battle against COVID-19. We now have 4,405 people hospitalized due to COVID-19 as of 8 a.m. this morning. This has clearly surpassed our highest numbers in hospitalizations from the spring. 914 of those patients are in the intensive care unit, and 465 of those patients are on a ventilator. The trend in the 14-day moving average of the number of hospitalized patients per day has increased by more than 3,000 since the end of September. Today, we are reporting 4,268 new cases of COVID-19 and 5,178 new cases from Sunday. This brings the total number of patients with COVID-19 in Pennsylvania to 361,464. Of our total cases, 60% are now considered recovered. This means that it has been more than 30 days past the patient's positive test or onset of symptoms. This number continues to decrease as we have more people who are testing positive for COVID-19. Tragically, 32 new deaths were reported today, and 75 new deaths were reported from Sunday, for a total of 10,383 deaths attributed to COVID-19. In the last week, we have reported more than 500 new deaths across Pennsylvania from COVID-19. The statewide percent positivity, as reported on the early warning monitoring dashboard, is nearly at 12% now statewide. Forest County is the only county in the state with a percent positivity below 5%. And in addition, 5 counties have a percent positivity greater than 20%. Throughout the pandemic, there have been nearly 28,000 cases of COVID-19 among children 5 to 18 years of age, and 8,150 of those have been recorded in the last 2 weeks alone. As I discussed last week, the decision on instructional models in schools is still a local one. And in a moment, Secretary Ortega will discuss more about the work that the Department of Education is doing to support schools. A little later, we'll be hearing from Dr. Shane Hotchkiss, Superintendent for Bermudian Springs in Adams County, on how the district is navigating education in the middle of this global pandemic. Today, we are launching an exciting update to our COVID-19 Alert PA app that will be a great tool for schools and parents to stay informed and help stop the spread. The COVID Alert PA app is now available for anyone aged 13 and above. The app has been available to Pennsylvanians 18 and older since its launch, and to date we have more than 623,000 people who have already downloaded the app. By expanding the age range, middle and high school students will be able to add their phones to the fight and help in contact tracing that occurs in their schools if a positive case is identified. Now, children between the ages of 13 and 17 can only use the app if a parent or legal guardian has reviewed and agreed to the use of the COVID Alert PA app on behalf of the young person. We've also added new features for all app users, including more county-level data and hospitalization information. We've also added an information hub where residents can learn more about contact tracing, app compatibility with other states, and where to find a testing location and other assistance and benefits. So parents, as a pediatrician, I am encouraging you to have your whole family download the COVID Alert PA app today. Pennsylvanians need to answer the call so that we are united to stop the spread of this dangerous and contagious virus. We need to answer the call and wear a mask. We need to answer the call to wash our hands and to social distance. And we need to literally answer the call when a contact tracer reaches out to you. And we need to download the COVID Alert PA app to add our phones to the fight against this virus. As we continue these efforts to fight COVID-19, please do not forget to adapt your activities to protect against the spread of this virus. And always remember, please stay calm, stay alert, and stay safe. And now I'd like to introduce Noe Ortega, Acting Secretary for the Pennsylvania Department of Education. Secretary?
Thank you, Dr. Levine. It's a pleasure to join you today. COVID-19 has no doubt shifted the way that we teach, learn, and live our lives. While 2020 has been a year unlike any one in history of public education, our school communities continue to show tremendous flexibility, grit, and resourcefulness. For that, I'd like to just take a moment to thank our schools and say how tremendously proud we are for their unwavering commitment to protecting their communities from the unpredictable virus and ensuring that students continue to have access to safe and quality education. As we continue to honor local control, we recognize that communities need to know that their schools are committed to the critical mitigation strategies. This is why our recently announced attestation form that we've done in partnership with the Department of Health helps ensure that schools continue to communicate the importance of mitigation strategies as they provide quality and safe education for their students. Thank you to all our school communities for their efforts as we move forward. We must continue to stay unified as we stop the spread of COVID-19. In addition to the health and safety mitigation efforts, I'm here today to join the Department of Health, Secretary Levine, and other folks on emphasizing the importance of taking advantage of additional resources. We have now partnered to ensure that young people, students aged 13 and older, can use their phones to also help curb the spread of COVID-19. We are here to issue a call to students across the Commonwealth, with parental consent, of course, that they please download the COVID Alert PA app to help protect yourselves, your families, friends, and communities in their health and safety. Thank you all in advance for answering this very important call and joining more than 500,000 people in using your phone to fight against COVID-19. Now, it is with great pleasure that I'd like to introduce Dr. Shane Hotchkiss, the superintendent of the Bermuda Springs School District, to share a few thoughts with the group today.
Thank you, Secretary Ortega, for the introduction. It is a pleasure to join you today to discuss how the COVID-19 pandemic has affected school districts across the Commonwealth and specifically Bermuda Springs. My name is Dr. Shane Hotchkiss, and I'm the superintendent of Bermuda Springs School District, which is located in northern Adams County. In addition to being a school superintendent, I'm also a parent to a first, fifth, and eighth grader. The COVID-19 pandemic has completely changed the way so many of us around the world operate. This certainly is the case in the field of education, as we've all faced truly unprecedented challenges. However, I know that at Bermuda Springs, we have a committed team of teachers, support staff, administration, school board, and a community that wants the absolute best for our children. We've had to balance the need for our students to receive the high quality education they deserve, while also committing to creating a healthy and safety environment as we work to mitigate the spread of this virus that we know can have a significant effects on our entire community. We have committed to actively monitoring the number of COVID cases in our county, as well as within the zip codes of our school district, like many others across the Commonwealth are doing. We monitor each week the data reported by the Department of Health announcing the number of 5 to 18-year-olds who've tested positive for the virus, and that it has increased in recent weeks. While some of these may be asymptomatic or have mild symptoms, we must remain vigilant in our mitigation effort. Bermuda Springs, like so many school districts across the state, has been actively working to follow the recommendations that have been put in place. We feel that these recommendations are our best effort to protect our students, our staff, and our greater community. Adams County, like most across the state, is in substantial level of transmission. Bermuda Springs has utilized a hybrid model of instruction for all students in grades K to 12. We recently did sign off on the attestation ensuring implementation of mitigation efforts, strengthening our commitment to adhere to and follow the Department of Health orders and recommendations by the Department of Education. Each day, I'm in awe of the work being done here by our teachers and staff as they continue to provide access to an excellent education for all students. I'd like to share with you some examples of our efforts. At Bermudian Springs Elementary School, all teachers in the building, along with all building aides, when I mean all teachers, provide weekly supports for students in guided reading and guided math groups. We've developed a remote day support team at Bermudian Springs Middle School that provides immediate virtual support from an adult to any student that is in need of assistance. While our middle school counselor, Mrs. Umball, has met individually with more than 50% of our student population in an effort to support their in-person and remote learning needs. The choirs of the district, under the direction of Mr. Matt Carlson, presented their first virtual performance of the school year, and it was amazing. Singers from grades 4 through 12 performed a song, Begin, that was actually written by Mr. Carlson for the pandemic. I would encourage you all to visit our website to hear this amazing production. Our work to prepare for the 2020-21 school year started in late spring. Our pandemic team, consisting of members of our teaching staff, our administration, operations, technology, facility staff, and parents, worked in specific groups that developed the foundation of our health and safety plan. That effort that everyone put into our planning has been instrumental as we've faced numerous obstacles and challenges as a school district. I'll be honest, the work was hard. It's still hard. However, those challenges and hardships are similar to those faced by districts across the state and across the country. I continue to remind our staff and community of the importance of building relationships, being flexible, and our commitment to meet the needs of our students in any way possible. I could not be prouder of the efforts of everyone here within our district. The thoughtfulness, compassion, empathy, and critical thinking of our team has helped us navigate through the challenges associated with the pandemic. And those are the traits, the ones that I see reflected in our students and our community. Those traits are instrumental as we continue to process and move forward through COVID-19. This global pandemic has challenged us all to our core, but I know we will emerge stronger and better. I have faith in our schools, I have faith in our community, and I have faith in our students. I know there's a silver lining somewhere to be gained from this entire experience. Thank you.
Thank you, Dr. Hotchkiss. I'll now hand the podium over to Dr. Levine for some questions.
Well, now we're very pleased to answer any questions.
Thank you, Secretary. Our first question will be Tyler Pratt. Tyler, go ahead and unmute.
Hi, sorry, I still haven't figured out how to unmute after all this time. Hi, my question is for Mr. Ortega.
Hi, Tyler.
Hi, Noe. This is Tyler with WLBR. With many districts shifting back to virtual learning after being in person and clearly maybe for a while, how is the Department of Education measuring student success during this time?
Sure. And so there's a number of ways that we've been working with our school partners to make sure that there's resources out there for them to think about success in terms of what they're offering at the moment. Just want to preface this by acknowledging the fact that in-person instruction is no way going to be replaced by remote and virtual options. And so what we do is make sure that folks have some of the best resources so they're able to provide not just the scaffolding needed in terms of development for young folks, but also a way to measure sort of the learning and development along the way. And so you can look at our website for a number of those resources. And then we continue to also reach out to our post-secondary partners, particularly in the area of schools of education where educator development occurs quite a bit as well, to also provide some support and resources to schools, particularly those that are in the proximity of their service areas.
Next up is Justin from PLS. Justin, go ahead and unmute.
My question is also for the Secretary of Education. Secretary, I'm curious if you could characterize with the push now with 13-year-olds and up able to download this app. Will the department be engaging in contact tracing efforts within particular schools? I'm just curious if you could kind of walk me through what these efforts could look like moving forward.
Sure, and so the department continues to work with the Department of Health as well, Secretary Levine, her staff, around the area of contact tracing. We don't have necessarily something that's prescribed by the Department of Education at the moment, but we are certainly continuing to work in partnership with the Department of Health to make sure that folks can play a role in some aspect of being helpful, particularly now that we're seeing tremendous amount of resurgence. And so while that's not a perfect answer, I'll allow Dr. Levine if she wants to add any other remarks around that. But that's what we've been doing with regards to our school entities.
Thank you.
Justin, any follow-up? Okay, next up is Jamie Bittner. Jamie, go ahead and unmute.
Hi there. I have a twofold question, if you don't mind. Number one, how will the parental controls on this app work when parents go in and go through the process of allowing their child to use it? That's my first question. And my second question to you is, as these cases continue to rapidly rise, I know you're allowing schools to make individual decisions, but do you have an opinion right now on whether schools should stay open throughout December if they have the capacity to go online?
Can I answer the second part of that question first and then hand it over to Dr. Levine for the first part? With regards to our recommendations, I just want to be very clear as you think through what the department has put out as a resource to help school leaders make decisions about what type of learning model they should put in place. All of these are contingent on the local levels of transmission, right? And by that, I want to emphasize the fact that what we've put out so far applies primarily to counties that are in the substantial level of transmission, right? Sort of the highest of our three categories. Within that level of transmission, we do recommend that schools consider moving to remote learning. In fact, that's what we're asking them to do at the moment. For those institutions, because I think I want to make sure that we honor the local control decision, for those institutions that choose not to move to a remote learning option, then the important aspect here is that they agree to double down through this attestation form to adhere to the mitigation strategy as it relates to face covering. And then on top of that, to make sure they monitor local levels of transmission that happen at their schools, right? And this is why we put out those two resources to make sure that schools are able to do that. So this is what we've been emphasizing in terms of what we expect for schools in the substantial category of transmission. I'll pivot over to Dr. Levine for some additional remarks.
Thank you, Secretary. So thank you for that question. So really, it's the same as any other app that a young person would download onto their phone. A parent or legal guardian must confirm that the young person can use the app by consenting upon the download and the initial usage of the app. So you really have to be 18 years of age in order to accept it yourself. And young people between 13 and 17, you can only use the app if your parent or legal guardian has reviewed and agreed to the use of the app on your behalf.
Thank you, Secretary. Next up is Tegan Simonton from the Tribune Review. Tegan, go ahead and unmute yourself.
Hi, Secretary. Thank you so much for taking a few minutes this morning. I'm wondering, with this milestone of so many hospitalizations, is the state considering additional mitigation strategies or another statewide lockdown at this time?
Well, we're going to be watching this data very closely. We watch all of the data, but particularly the hospitalization data, the intensive care unit data, and we compare this to the different models that exist. So we're going to be watching that carefully. I mean, we have no plans for further mitigation. We had instituted mitigation over the last 2 weeks, and we'll be observing the impact of that, but it's hard for me to predict the future in terms of what will be necessary later. In addition, actually today, coming onto our website will be a depiction of the different measures that we talked about last week for hospitalizations that would trigger the decrease in elective procedures. So that will be on our website as well. And to date, no healthcare region has triggered those metrics.
Thank you.
Okay, next up will be Nicole Ford. Sorry, give me 1 second, please. Nicole, go ahead and unmute.
Good morning. My question's for the Education Secretary.
Sure.
Hello. So when it comes to these recommendations, a lot of parents are seeing the word substantial and they're questioning how long we could potentially be there, how long their kids are going to potentially be in this remote learning. Can you kind of break down what puts us in substantial and at what point a local school district may move out of that remote learning?
Sure. So the gating indicators that we've put down with regards to determining when a county moves from low, moderate, and substantial, we've been working with the Department of Health, and we've been using these for some time. And primarily, it includes with the number of positive cases in the area. How long a particular school district can expect to stay in a particular category. We do monitor these the incidence rates for 2 weeks, so 14 days. Generally, what we do is we would not require someone to pivot from a different kind of learning model to remote learning unless they've been in substantial for at least 14 days. So that very much also models the path backwards. And by that, I mean a county can move from substantial to moderate. After being 14 days in moderate, then they're allowed to pivot the type of learning modality that's recommended by the Department of Education and Department of Health. This is to move from remote learning to a hybrid model. And then again, if they are in a different category for another 14 days, by this would be moving from moderate to, let's say, low. That could happen. From the start, since we put out our guidance for the type of learning models that we recommend, we always made sure that schools understood that there would be a need to pivot across the various categories depending on the transmission levels that occur. And so for many schools, they've come to an understanding of knowing how the path backwards and the path forward in terms of learning models would look like.
Just to follow up to that, if a school doesn't follow your recommendations and in turn has an outbreak in the school, is there any repercussions for that?
Sure. At the moment, the attestation form that's being filled out by schools, public schools that are in the substantial category, do require that they would adhere to the face covering order that was distributed by the Department of Health more than a week ago. If they don't adhere to it, then what would happen is they would be required to move to remote learning, and in addition to that, suspend extracurricular activities that would include athletics, for example, as well. And so this is the level of enforcement that we've put in together, that we've built into the attestation form.
Next up, Nicole Brambilla. Nicole, go ahead and unmute yourself.
Thank you for taking my question. This is for Secretary Levine, please. Thank you, Secretary, for taking my question. I have two. I was hoping you could tell me about the ICU capacity statewide, and then a second but related question has to do with our county coroner today is reporting that more than half of our deaths now are taking place for individuals who are not in congregate care settings. And I'm wondering if this is a trend that you're seeing statewide.
So right now, as I mentioned, thank you for your questions. We have 914 patients in intensive care units. I think intensive care units and hospitals in general are strained. I think they're strained throughout the state. There are some specific regions where there's more strain. A little bit less, actually, perhaps with the holiday weekend, but we're very concerned about the hospital capacity, which is why we've asked the hospitals to collaborate regionally in terms of their bed capacity, in terms of their ICU capacity, in terms of their staffing, et cetera, and why we've put those metrics on the dashboard that is now on our website. So we really want them to self-regulate their own hospitals and regionally in terms of these quote-unquote elective procedures so that they have the staff and the beds available to take care of patients. We're going to be monitoring that really, really closely. And your second question again?
Sorry, Secretary, she's muted. The second question was about the coroner reporting more than half the deaths were not from long-term care.
So we are seeing more deaths in Pennsylvania, and we have reported upon that. We have seen some more deaths in long-term care facilities, but the percentage is less. So we are seeing actually more deaths than, outside of long-term care living facilities than we saw in the spring. And I think that that's just reflective of the community, the widespread community transmission of COVID-19 in all regions of Pennsylvania. And tragically, this virus can be extremely serious and can lead to significant mortality. And so that's why we've been emphasizing what we've been saying all along, the mitigation measures and some of the simple things that we've been repeating over and over again since the beginning about wearing masks, washing hands, social distancing, and now including avoiding large and small gatherings.
Next up is Colleen from WTAJ. Go ahead, Colleen. Colleen, we're having some difficulty hearing you.
There you go. Can you hear me now?
We can, thank you.
There we go. Thank you so much. My question is for the Secretary of Education. Good morning. I have two kind of questions. First one, Central Pennsylvania has really been hit hard by the virus, especially in the past, 6 weeks. We've had some school districts where hundreds of people have had to quarantine because of cases. Not necessarily the amount of cases, maybe 25 in a district, but it's the contact tracing and the quarantining. Was this possibly one of your fears as schools kind of got back into the swing of things with in-person classes? And my second question is, as the winter break is going to be coming up in the next few weeks, what's the school district as they can kind of regroup and plan for the next semester?
Sure. And I think I understood the second part of the question, Colleen. You were breaking up, but I'm going to sort of try to answer. I'll begin with the first one. With regards to the biggest fear that you raised at the beginning in terms of the transmission, one of the things that we've always acknowledged at the department, and I think it's been the case with the guidance that we've put forward, is that schools don't operate in a vacuum. And many of the things that we see happening at our schools are in many cases a result of what's happening at the community as well. In addition, we also know the importance of making sure that we at least give provide our school leaders with a number of tools as they begin to move to more normal routine operations, simply because schools are essential for a number of the provision of services, right? Beyond learning, there are places where for many kids they find meals and other things that are certainly life essential. And so, of course, as they interact with the communities, it is our concern that if they don't adhere to a lot of these mitigation strategies, and many of the ones that Dr. Levine and others have really stressed, physical distancing, face coverings, cleaning protocols, as well as personal hygiene, then we would fear that there's transmission levels that happen at all places that not just affect our educator workforce that's at the school with the students, but also the individuals that these students interact with, right? And this goes beyond just the teachers and the school leaders in the classroom. These are staff and personnel that are required at every level, plus the people that are in sort of the support system for the students in their home as well, and then so on. With regards to the second question, do you mind repeating that, because you were breaking up in terms of the connection?
Sure. Can you hear me better this time?
Absolutely.
Excellent. So my second question was, the winter break is coming up in a few months. Some of our schools have already said, we're going to stay remote until the beginning of next year. What's some advice that you have for school administrators, for teachers to possibly take this break to regroup and maybe find a different strategy if the ones that they were using recently weren't quite working?
Sure. And so we've continued to work with the Department of Health. Early on in the summer when we released our guidance, it was always concerned as we were forward-looking what the transmission of COVID-19 was going to look like moving into the winter months, how it was going to interact with all the things that we come to expect and usually associate with winter, which includes flu transmission, et cetera. And so those always remain concerns that we want to make sure that schools are willing to account for. I do think that the holiday, as we move into the end of this year and think about what school year looks like next year, is a really good opportunity for schools to begin to regroup and to begin to think about how to create the safe spaces that would be conducive to really moving to something that looks like a more familiar in-person instruction offering in the winter months. This is also a time to begin to think about how the provision of remote or hybrid learning can look like at your particular schools. What might you begin to factor in terms of not just the learning and development for young kids, but a lot of concerns around mental health, well-being as well. And so it's a really good time to step up efforts as we think about engaging in all those other parts and then begin to move towards creating more safe conditions. We are committed to working with the Department of Health and others to make sure that we can provide as many resources for schools to think about what they might be able to do in those moments as well.
Thank you. Next up is Flora Pastorero from Penn-Watch. Flora, go ahead.
Hi, my question is for the Secretary of Education. Secretary, the Education Department currently has a list of vaccines that are required for students to enter school at certain ages. When the vaccine becomes available for COVID, do you anticipate adding that vaccine as a requirement for students to return to school? At what age would they have to have that vaccine? Also, a second part of that question, would you be calling on schools to administer the vaccine as had happened in the past with H1N1?
Flora, Secretary Levine will take that question.
Well, thank you for that question. We have no plans to make the COVID-19 vaccine required for anyone, including school children. In fact, there really have not been adequate studies done to date with the vaccines on children under 18 years of age. Some of the companies are starting those trials now. So we'll wait and see what the science tells us in terms of the vaccine in young people. We expect it to be safe and effective, but we're going to have to prove that. We do not plan at this time to immunize children through the schools. We'd be working more through the healthcare system, including when the time comes where children are indicated to receive the vaccines through their healthcare personnel, pediatricians, family physicians, and perhaps pharmacies. So we're still working out that plan, but again, the vaccines aren't licensed for children. Thank you.
Next up, and our last question for today is Davin Kurtz. Go ahead and unmute. Our last question for today is Davin Kurtz. Go ahead and unmute.
Hi, thank you so much. My question for the Secretary, I know it's early to tell, but when are we going to start seeing kind of the fallout from the Thanksgiving holiday, and keeping that in mind, what do you say to folks going into yet another holiday of gatherings?
Sure. Well, thank you for that question. You know, Dr. Fauci spoke about that this weekend. In public health, we are very concerned about the potential impact of the Thanksgiving holiday, and particularly those people who, despite our advice, traveled. Unfortunately, the airports were often quite crowded, and that those that did have, smaller and larger gatherings. And so, we would recommend that certainly we have specific traveler advice. I think that those that were in gatherings, should consider whether they would like to quarantine, just kind of assume that maybe they were exposed and to quarantine. Certainly people, if they have any symptoms whatsoever, should get a test. People could consider getting a test, a week after their travel, et cetera. And I know Dr. Fauci had mentioned that, and Dr. Birx has mentioned that as well. So we're concerned. Our recommendation for the upcoming holidays is to please stay home. And I know that that is a tremendous sacrifice for Christmas, for Hanukkah, for Kwanzaa, and for New Year's. But our recommendation is to stay home within your household, not to travel, so not to go on planes, not to go on trains and other means of travel, and to stay home and to communicate and be with your extended family and friends on remote platforms. This right now, this November, December, January, February, this is looks like it's going to be the peak time in terms of transmission of COVID-19 for this global pandemic. We're very hopeful about the upcoming FDA and CDC meetings, very hopeful about the Pfizer and Moderna vaccines being approved, and then we will stand ready to distribute and administer those, but they're going to come out slowly, and until the general public is immunized, would probably start late spring to summer, until the general public is fully immunized would happen after that. And so this winter is the key time, and we all need to stand united. We need to stay home and prevent the spread of this virus, and I think that 2021, especially the second half of 2021, will look much, much better.